So thank you for your kind invitation to join the LDC Conference digitally today. We're certainly in unusual times. I want to take this opportunity first to thank all of the dental profession for your efforts throughout the pandemic and your continued efforts now as we resume face-to-face dental services. COVID-19 has created turbulence and uncertainty for many of us, both professionally and personally. And these are unprecedented times, and we appreciate that it wasn't easy for you as clinicians to be asked to suspend routine dental care for your patients. This decision wasn't taken lightly, but it was necessary to support the wider national response. I appreciate that the complex management of the risk of COVID-19 transmission in dental settings has presented very significant challenges for you as a profession and continues to do so. But despite that, there has been an amazing team spirit, and the collaboration and working across boundaries has been really inspiring. There is nothing but praise for the work of local dental networks, LDCs, and the profession more broadly, who across the country, I believe, have risen to the challenge. So on behalf of all the health ministers, we are incredibly grateful for everything you've done. Whether you were at the end of the phone, offering patients advice, or prescribing antibiotics or painkillers to a patient in pain. Whether you were working in one of now over 600 urgent dental care centres established across the regions, donning FFP3 masks and additional PPE in order to provide face-to-face care for those seeking urgent and emergency care, or whether you were one of those who kindly put their hand up and said, please redeploy me to support that wider COVID NHS response. You've provided exceptional services under exceptional conditions, I believe, and I'm sure patients have been incredibly grateful for the service that they've received. Your hard work, dedication, and willingness to help that wider effort hasn't gone unnoticed or unappreciated. Just for a moment, I would also like to recognise that your contribution goes so much wider than improving oral health. In fact, your role makes a valuable contribution to the overall health of the population, something I would like us all to sing a little bit more about in preventing and detecting such conditions as oral cancers and diabetes, but also in the present debate on how much sugar we eat and our diets. So this is why when returning to providing routine care, it's really important. Although I acknowledge there are many challenges with doing this, and we expect the pace to be largely dictated by local circumstances, that overall population health and your help in looking after the population is vital. I do know you will have seen the recently published letter from NHS England setting out the contractual approach for the rest of this financial year. The approach recognises that we're not in normal times. We understand that it's impossible at this time to deliver the usual amount of activity. We do appreciate that additional time that you're spending doing enhanced cleaning, infection control, putting on PPE, and the impact that having resting surgeries following any AGP procedures is having on clinical practice. The approach that's been taken by NHS England recognises this and rewards those who remain committed to the NHS care that is given. We hope this support is received in a way that gives some comfort and reassurance that contractors will continue to get paid for what we believe is a fair, reasonable and achievable amount of patient care activity at this time. Now, moving forward, the NHS is restoring and reshaping its services, recognising some of the constraints put on it by COVID-19, but also looking to incorporate some of those learning and experiences from the last 5 months. The NHS, including dentistry, has responded in extraordinary ways, showing us that it's possible to do things differently, and in some cases better, smarter, and fully utilising technology. It's been necessary for dentists and their teams to rapidly remobilise and deliver care in a different way. The very positive introduction of remote care has clearly demonstrated its value as one that we may wish to talk about, maintain in the long term for dentistry, as well as in other areas of the NHS. Not an instead of, but an addition to. At this time, where practices are having to implement fallow time between patients and remote care, that remote care can provide the perfect opportunity to maximise clinical downtime, improving patient access through remote service delivery where possible. And remote care also gives the opportunity to utilise the full range of skills that your dental teams have in providing that care, because we know that it's everyone that has had to make these adaptations and changes. COVID-19 has given us the opportunity to think differently about how we deliver dentistry to ensure that access can be focused on those who need it most. So for the future, remote care might offer a way to help dentists and patients move away from that very traditional 6-monthly checkup pattern, which can persist even for healthier patients who NICE guidelines would suggest don't need a routine checkup nearly as often as every 6 months. This impacts on access for some of the higher needs patients, where patients don't need such frequent checkups. They could be offered an appointment at an appropriate interval, but with a call just to reassure them and the dentist and the team that nothing is going on that they may need to check on. Without doubt, we know that oral health inequalities are likely to have increased during lockdown, and now more than ever, there is a need to increase access and reach out to the more vulnerable and disadvantaged groups in society. NHS England has an ambition to take forward a number of key initiatives to reduce oral health inequalities, particularly for children and those who are elderly and frail. This includes re-establishing the Starting Well programme to reach out to children most at risk of poor oral health, and promoting the Dental Check by One initiative, which was showing huge success. Enabling practices to support PHE, local oral health improvement programmes, actually targeting responses to an area need. Providing dental checks in special educational settings for those children with learning difficulties and autism, and enabling dental practices to provide support to care homes and residents as part of the enhanced health in care homes framework. Now, overall, this pandemic has reinforced the need to tackle health inequalities and inequalities in general, and for prevention to be fully embedded within our NHS dental provision. And that's something I've spoken to many of you about over the years, and how you see that as a core reason as why many of you entered the dental profession, to protect teeth in the first place. So with that in mind, I think there's a real opportunity for dental teams to support prevention, broader population health, and improved health outcomes, and really take their place on that podium of a health professional that you ask for advice about these broader issues, such as your diet, your oral care, and so on. There are already really good examples, and future commissioning of services needs to recognise and support these benefits through the adoption of flexible commissioning. So leaving you on that point, I would like to once again thank you for the kind invitation to join you, albeit remotely, today. As we look forward, you have my absolute commitment to continuing to work collaboratively with the dental profession, who I've met with throughout this time, in order to develop a sustainable, long-term approach to dentistry that can provide accessible and safe care to the patient with prevention and patient at its core, enabling the whole team to really flourish and give its all, whilst looking after that team, as I know you all have done through this difficult period. So I'd like to finish just by saying thank you.